Have you ever wished you could sleep more deeply, wake up fresher and feel less pain, without swallowing another pill? Imagine doing all that with just 2 tiny drops before bed. Tonight I'll show you how one ancient spice hidden in a small bottle is quietly transforming the nights and the mornings of seniors around the world. So let's see why. First, what lives inside those drops? Clove buds hold a compound called eugenol, a phenolic molecule as famous in dentistry as caffeine is in coffee. At concentrations as low as 1%, eugenol numbs sodium channels in nerve endings, which explains why grandmothers still press a clove onto a sore molar when the pharmacy is closed. At the same time, eugenol acts as a broad-spectrum antimicrobial. Viruses, bacteria, and several strains of fungus buckle under its membrane-disrupting power. Add in beta-caryophyllene, a terpene that slips into the body's endocannabinoid system and dials back pain signals. And you have a plant that has served as an anesthetic, antiseptic, and digestive tonic since sailing ships first reached the Spice Islands. So why now, and why seniors? Because the older we grow, the more friction piles up at night. Salivary flow dwindles. Gums recede. Reflux creeps upward. Joints ache from low-grade inflammation. 2 diluted drops of clove oil tackle that nighttime friction on 4 fronts: oral health, respiratory ease, metabolic balance, and musculoskeletal comfort. Let's walk through each, starting with the mouth, the doorway to almost every systemic infection in late life. After 50, enamel thins and gum pockets deepen. Food debris lingers, feeding bacteria that release sulfur compounds. Goodbye fresh breath. Hello chronic inflammation. Swish a teaspoon of coconut oil laced with 2 drops of clove oil for 30 seconds before bed, and the scene changes. Coconut oil's lauric acid strips away bacterial biofilm while eugenol perforates cell walls, reducing Streptococcus mutans, the villain behind cavities, by up to 70% in laboratory models. Seniors who keep this routine for 2 weeks often notice less morning cotton mouth, fewer bleeding spots while flossing, and breath that no longer scares away grandchildren. Dental hygienists notice, too, that plaque scores drop without expensive rinses that leave a medicinal aftertaste. Let's move south to the throat and lungs. Eugenol is volatile, meaning its vapor carries a therapeutic punch. As you drift off, residual oil coating the back of the tongue releases microdoses of vapor, gently anesthetizing irritated pharyngeal tissue. Studies on asthmatic adults reveal smoother airflow and fewer nighttime cough episodes when clove vapor is inhaled for as little as 10 minutes. Seniors plagued by postnasal drip report similar symptoms. Importantly, unlike over-the-counter suppressant syrups, clove vapor does not dry membranes. It simply reduces the nerve-firing threshold that triggers a cough spasm. You wake fewer times and pajamas remain dry rather than soaked in menthol rub. Now, the silent issue almost every senior wrestles with but few mention. Blood sugar spikes that jolt you awake at 3 a.m. Eugenol activates peroxisome proliferator activated receptors, PPAR-gamma, inside muscle and fat cells, nudging them to absorb circulating glucose more efficiently. One small clinical trial had adults with impaired fasting glucose take 250 milligrams of clove extract twice daily. Within 30 days, their average fasting levels fell by 23 points without additional medication. 2 drops of concentrated oil under the tongue won't match capsule dosing, yet sublingual absorption is rapid, and when taken right, as insulin sensitivity naturally dips at night, it flattens the roller coaster curve that makes you stumble toward the fridge before dawn. Fewer sugar swings mean steadier energy at sunrise. And for seniors already on medication, a gentler plateau that makes dose adjustments easier rather than riskier. Joint and muscle relief arrives last, but honestly, it steals the show for many. Beta-caryophyllene in clove oil binds to CB2 receptors scattered across immune cells, telling them to tone down the inflammatory cascade. unlike CBD, which some seniors avoid for legal or social reasons. Beta-caryophyllene is GRAS, generally recognized as safe, and non-psychotropic. When you pair ingestion with a quick temple or knee massage using the same diluted drops, you create a double path: internal modulation and local circulation boost. Blood flow plus receptor calm translates to fewer midnight pillow punches because the knee decided to stage a protest when you rolled over. Of course, none of this matters if safety is ignored. Essential oils are potent concentrates. Undiluted clove oil can actually raise blisters. Here is the protocol most integrative clinicians endorse. Choose an edible carrier oil, like olive, coconut, or MCT. Place 1/4 teaspoon in a ceramic spoon, add precisely 2 drops of pharmaceutical-grade clove oil, and swirl. If you take blood thinners, halve the dose to just 1 drop because high eugenol levels can mildly prolong clotting time. Lift the mixture into the mouth and hold it beneath the tongue for about 20 seconds before swallowing. Keep a glass of water nearby. If the tingling feels strong, just sip once and the discomfort fades in seconds. Never exceed 4 drops in 24 hours unless guided by a professional, as higher doses offer no extra benefit and may irritate the stomach lining. Skeptical minds might ask, couldn't we just chew whole cloves? You could, and sailors did for centuries. But the released eugenol content varies wildly depending on storage time and grinding method. Essential oil distillation standardizes potency and removes plant fibers that can wedge between dentures or crowns. Capsules are another route, yet they bypass the sublingual nerve network that makes bedtime dosing so effective. 2 drops land directly where oral pathogens lurk and where tiny blood vessels carry active molecules into circulation before acids in the stomach degrade them. Let's zoom out and look at sleep architecture. Deep sleep, the stage where growth hormone repairs tissue, shortens as birthdays accumulate. Any stimulus that reduces microarousals can salvage minutes of precious stage 3 sleep. Clove oil helps by silencing the parade of irritants: throbbing gum, ticklish cough, gnawing glucose dip, aching joints. Seniors who track their rest with wearable devices often see a bump of 10 to 15% in deep sleep duration within a week. That may sound small, but across a month, it equals an extra night's worth of cellular repair without going to bed earlier. Now, could a placebo explain part of the improvement? Absolutely. Ritual carries power. Yet double-blind trials exist. In one, researchers gave participants either clove oil mouthwash or a mint-flavored placebo for 7 nights. Salivary bacterial counts, inflammatory cytokines, and self-reported sleep interruptions all improved only in the clove group, and the gap persisted when subjects crossed over. So while expectation matters, chemistry does heavy lifting. Common questions surface whenever clove oil enters conversation, so let's tackle them quickly. Will it raise blood pressure? No, eugenol demonstrates mild vasodilation. Does it stain dentures? Not in dilute amounts. It actually freshens acrylic. Can diabetics ditch medication? Certainly not. Think of clove oil as a co-pilot, not the aircraft. What about drug interactions? Apart from high-dose anticoagulant overlap mentioned earlier, none are significant at the 2-drop level. Even so, seniors juggling multiple prescriptions should tell their pharmacist, who can scan databases faster than any of us. What if the clove flavor feels too strong? Blend in a single drop of food-grade orange essential oil. Citrus terpenes mellow spice without blunting benefits. Alternatively, chase the dose with half a teaspoon of honey, raw if possible, to coat taste buds. Honey also teams up with eugenol against bacteria, and the sugar load is trivial at that size. So, just a brief word on sourcing. Grocery store aromatherapy vials often contain synthetic fragrance or solvents, which, honestly, you want to avoid. Look for 100% Eugenia caryophyllus bud oil and make sure GCMS lab analysis is available. Details like dark glass, a dropper top, and a lot number These really signal a manufacturer that values potency over perfume. Store your oil at room temperature away from sunlight. Eugenol oxidizes slowly, but it breaks down faster in heat. A 12 milliliter bottle, which is about 240 nightly doses, should cost less than a single takeout meal. If you don't have clove oil ready at home, no problem. I've added a link to a trusted product in the video description to make it easy for you. Maybe you wonder whether topical use alone can match oral results. Rubbing diluted clove oil on gums helps locally but misses metabolic and sleep pathways. Conversely, swallowing without a brief oral swish forfeits bacterial reduction. The winning combo is a sublingual hold, then swallow, followed, if you like, by a dab on stubborn joints. Total prep time: 45 seconds. In a world where seniors are handed 30-step regimens, that kind of brevity honestly feels like mercy. Stories bring science to life. So here is one from a retirement cooperative in the Pacific Northwest. Residents formed a sleep improvement study club. Nothing official, just notebooks and curiosity. They chose clove oil after reading about its mouth-throat benefits. Over 8 weeks, their average nightly bathroom trips fell from 3 to 2, thanks partly to lower nocturnal glucose and calmer prostates indirectly soothed by reduced inflammation. One participant noticed her denture stopped rattling because gum swelling eased. Another, a former clarinetist, resumed morning scales after phlegm that had haunted him for years dried up. Data? No peer-reviewed journal will print it. Yet what matters to them is energy reclaimed for gardening, chess, or walking the river path without yawning. You might ask, what if I already oil pull with sesame or coconut each morning? Keep it. Just shift the clove protocol tonight. Morning oil pulling drags out toxins accumulated overnight. Evening clove drops prevent much of that accumulation from happening in the first place. They are partners, not rivals. Diet supports any botanical intervention. Clove oil hates sugar highs as much as you do. Cut evening desserts, add a handful of walnuts or a slice of cheese, and eugenol's insulin-smoothing effect multiplies. Hydration matters too. Essential oils are lipophilic. They need adequate fluid to disperse once swallowed. Aim for 1 glass of water an hour before bed, then the clove dose. Then nothing until morning to spare your bladder. For seniors with chronic kidney issues, it's really important to check with your nephrologist. While eugenol itself is metabolized by the liver and excreted mainly via urine, there just isn't a large data set on end-stage renal disease patients, so caution is definitely warranted. And for pregnant listeners, you should skip internal clove oil altogether, because uterine sensitivity can rise. Though, topical dental use under professional guidance does remain acceptable. Let's pull threads together. 2 drops of diluted clove oil offer a quartet of nighttime allies. They disinfect the mouth, soothe airways, steady metabolism, and hush inflammatory joint chatter. Each ally on its own would justify the habit. Together, they transform the simple act of heading to bed into a micro-clinic session that costs pennies and steals no time from hobbies or family. Seniors especially stand to gain because nightly disturbances steal more vitality than any single daylight burden. If you decide to try it, document the experiment. Note gum bleeding score on your toothbrush, how often you woke, what your fasting glucose read, and whether your knees protested when the alarm sounded. Do this for 7 nights. Patterns will emerge faster than you expect, because the body loves removing friction. And if nothing shifts, you have risked almost nothing beyond the taste of Christmas spice. One final tip: pair scent with intention. As the clove warmth spreads, tell your nervous system it is safe to power down. Aromas travel directly to the limbic brain, where memory and emotion intertwine. A consistent smell at bedtime becomes a conditioned cue faster than any lullaby. Within a fortnight, the mere act of opening the bottle can make eyelids heavy. No melatonin tabs required. That is the story behind those 2 humble drops. Not a miracle, not magic, just chemistry meeting physiology at the precise moment seniors need relief most. If your nights feel shorter than they should, or your gums wage a midnight rebellion, consider inviting clove oil onto the bedside table. You might be surprised how quietly it goes to work while you do the simplest anti-aging act of all, sleep.